Hello, everyone, and welcome back to Medigap Show. I'm Holly Cohen, licensed agent and founder of medigapcares.org, where we're dedicated to helping you navigate the intricate world of Medicare. Welcome to today's deep dive into the dynamic realm of Medicare Advantage. Let's begin with a thought-provoking article titled, Medicare is quietly being privatized. Does anyone care? Featured on MarketWatch. Whenever you hear the term, the privatization of Medicare, it is in reference to a private insurance company taking over your federal, original, traditional, red, white, and blue Medicare. Election time next year, and we're going to hear that often. I always hear it during election periods about the privatization of Medicare. Okay, let's get into the article. The campaign to privatize Medicare has just passed a landmark. This year, for the first time ever, more than half of all Medicare beneficiaries are enrolled through private insurers, meaning Medicare Advantage, in a system known as Medicare Advantage. In 2023, 30.8 million people are enrolled in a Medicare Advantage plan, accounting for more than half, or 51%, of the eligible Medicare population, and $450 billion, or 54%, of total federal Medicare spending, that's the net of premiums, reports the healthcare nonprofit and think tank, the Kaiser Family Foundation. You can find more about that in a prior video as well. As recently as 2005, privatized Medicare plans accounted for just 13% of beneficiaries. By 2033, they are expected, and I'll be in that group of 2033 Medicare beneficiaries that they're talking about in the future, they are expected to be above 60%. So it is on the rise. That's how it's expected to go. This is a remarkable evolution. Medicare was created as a government program, but today more than half of its beneficiaries are in the hands of private insurers rather than our federal government Medicare that we pay into. Private Medicare plans have existed since the 1970s, but only really took off in recent decades. A big change came under President Obama, his Affordable Health Care Act, which became known as Obamacare, improved the system and drove down costs and introduced incentives for insurers to make their plans better, including a star rating and annual bonuses for hitting quality targets. So the insurance companies, to hit these targets of these 5-star ratings, they get bonuses from the federal government. The process of privatizing Medicare has been surprisingly uncontroversial so far. For one thing, it doesn't easily fit into a TikTok video. That's funny. Is it a good thing? Maybe. Consumers are certainly voting with their feet. Medicare Advantage plans typically operate through HMO or PPO networks, which give them greater control over costs. Most Advantage plans include benefits not offered by traditional Medicare, typically free prescription drug coverage and vision, hearing, and dental coverage. And also, most of the nursing homes, from my understanding, will only take original Medicare. Harvard's T.H. Chan of public health and health tech company Invalon are currently engaged in a deep dive into the mechanics and economics of Advantage. Initial findings seem mixed. Interestingly, they have also found that those enrolling in Medicare Advantage are on average poorer than those enrolling in traditional Medicare. Advantage enrollees are twice as likely to be people of color and on average have lower wealth and are less likely to live in affluent neighborhoods. This shift, though gradual, is becoming increasingly pronounced with time. Basically, the cat's out of the bag. This article ignites a discussion about the potential implications of such a transformation. It urges us to ponder whether the core values of Medicare, are aligning with this new direction that the privatization is taking us in. We can understand more how Medicare Advantage has changed since it began in the 1970s. That was the beginning of the privatization of Medicare. In the late 80s and early 90s, Medicare Advantage plans became born, and they were part of the Balanced Budget Act. From that time until now, in 2023, Medicare Advantage plans have gone very high with the max out-of-pockets. They have overwhelmed our news channels with all those commercials that are about Medicare Advantage, not about original Medicare. Stay tuned for more informative information and changes within our Medicare and our Medicare Advantage programs. Feel free to comment below any questions. We are happy to answer them. Thank you for joining me today on this exploration of Medicare Advantage. Stay tuned for more updates about Medicare. Stay informed, and remember, knowledge empowers you to make the best choices for your Medicare journey. Until next time, take care, goodbye for now, and as always, be well.